This is the final presentation by Group 29 for CS 6440 Health Informatics Fall 2015. The identified domain for the project is Population Health. The final product is a web application entitled Immudata. The Immudata team consisted of Blake Holtzen, who served as the lead developer and architect, Richie Choy, who served as a developer and also managed group communication. The lead web developer was Susan Victoria Hurley. Back-end developers were Kelly Nielsen and William Phalen. Gail Larkin handled business analyst quality assurance duties, served as the subject expert on the high charts JavaScript library used for graphing, and assisted with web development. Vaccinations are a critical component of overall population health. Public health policy and the administration of vaccines are limited by the complexity and lack of knowledge regarding immunization data. Public health policy could be tailored to address specific areas of concern, but this requires more data analysis than is currently available to policymakers. Leveraging diverse immunization data repositories creates a unique opportunity to improve the understanding of the vaccination domain and to ultimately improve public health at both the policy and practitioner levels. The goal of the Immudata team was, therefore, to aggregate existing data and to offer the end user an easy-to-use tool for viewing that data.
Immudata Overview. Immudata is the name of our public health population health application. It is a graphical tool for tracking immunization trends over time. It analyzes CDC data from the last 5 years. It also allows the user to query based on demographic data, such as income level, race, and marital status of the child's mother. After running the query, Immudata generates a graph like the one seen here. To see the app in action, please click on the link provided.
Once you start the web application, you immediately arrive at the landing page. This home page contains the essential information on getting started with Immudata. We created 5 tabs to explain more about Immudata. We reiterate the problem statement so that the user understands the context of the problems we aim to solve. The overview covers how the application works and solves the problems that we outline. The Users and Benefits section describe the impact of Immudata. Project considerations go into the implementation details and talk about FHIR. And the Data Sources section describes where we got our immunization data. Finally, to navigate from the home page, simply use the navigation at the top of the web page.
By using Immudata, a user can filter data from the more than 2 million immunization records available in the CDC database to find and compare the public health results that matter to them. Any or all of the filters can be used together to filter the data. Users are given the option of which of the 41 vaccine types to research. They can filter by the child's individual characteristics, such as gender, race, and age at the time of immunization. They can also filter by family demographics, such as the state of residence, family income/poverty level, or the mother's marital status. The results graph enables a broad look at year-by-year trends for the immunization. For more details about matching records for a given year, a user can mouse over the graph to get a look at the specific number of qualifying immunizations.
On this slide, I will give a brief walkthrough of the ImmuData Systems Instructional Guide. This online guide describes how to navigate the system, how to use the Query Builder tool to display results, and describes available exporting options. The user guide provides a convenient online reference to the system and can be accessed from any page in the application by clicking the user guide link. The home page provides an overview of the project. The Vaccinations page displays the Query Builder interface tool, query results as described on the previous slide, and available exporting options that include printing of the chart and downloading the chart in various formats. And finally, the Contributors page lists the development team for this project.
Data sources and FHIR technology. Our data source for the app is CDC data. We chose to use the CDC instead of FHIR data, mainly due to the large amount of raw data with the CDC dataset and that it is anonymous. Our dataset is from the National Immunization Survey from 2010 to 2014. The dataset is quite large and contains over 125,000 patients. This dataset only covers children from the age of 19 months to 35 months. To get the data in a usable form, we use SAS inputs to populate our database. Two possible future enhancements we would like to make would be to incorporate the NIS teen data for the same years, 2010 to 2014, and 2008 and 2009. We also would like to use the CDC's 2009 H1N1 flu data to be able to gauge public response to an influenza pandemic.
ImmuData's target users are individual medical practitioners, as well as public health researchers or policymakers. Its primary use is to aggregate individual patient records and make the data easily accessible without any further processing. For doctors, ImmuData allows them to focus specifically on the data collected in their home state. They could use this to get a feel for the cases they're likely to see, and to detect any issues they may need to educate their patients about. Public health researchers will also benefit from having this data in an easily searchable format. They can compare individual areas or observe nationwide trends. ImmuData allows them to track changes over time in order to observe the effects of current immunization practices. It will also help to detect problem areas that may require intervention in the future. We would also like to acknowledge the help of some individual users. My aunt, a hospital nurse, provided information on vaccines the industry considers important. Victoria's daughter, a medical student, suggested some potential target markets for ImmuData. ImmuData uses an ASP.NET Web Forms front-end. The app controller and business logic are implemented in C#, as is the data interface. Immunization data is stored in a SQLite database. Source control is privately hosted on GitHub.